Hi, I'm Dr. Bardia Anvar from the Skilled Physicians Group. Today, I would like to go over a more extended video on some practice tips being out there with the coronavirus. We've already gone over masks. If you'd like to learn more about proper mask wear, please watch my video on masks. Once again, when you do wear a mask, please make sure that your mask is covering both your nose and your mouth when out in public. And definitely there is evidence, a lot of evidence out there, that masks are effective in preventing the spread and transmission of the coronavirus. As a physician, as a surgeon myself, I've encountered many viruses and many bacteria that are pretty lethal and deadly. I get asked this all the time, are you afraid of the disease? And I would say that I'm not afraid, but I do respect the disease. So I won't go out there and be cavalier about how I handle myself or tell people to handle themselves when they're outside. So should we fear the disease? Not as much. Should we respect the disease? Yes. We should respect all diseases. Now, people do a lot of things that are harmful to themselves. People smoke, people eat foods that are not healthy for themselves, and they develop diseases. Same thing here. If you want to be healthy in the time of this disease, then there's some practices you can do. One of the first things that was talked about was washing hands. We say wash hands for 20 seconds. The reasons why you have to wash hands for 20 seconds is that just putting soap on your hands and rubbing it doesn't actually work. The soap actually has to foam up. When the foam hits your actual skin, then the foam will start bursting viruses and bacteria and everything else. So you want to wash your hands. Now, when you go out into the general public, like right now, I'm in an office building, I'm touching public surfaces. After I touch those public surfaces, I want to wash my hands. If you're going outside and you're going to be touching a lot of public surfaces, it's not a bad idea to wear gloves. If I do wear gloves, I do sanitize my hands before I put on the gloves. So I put on a little bit of hand sanitizer and I rub it. Now, when you rub the hand sanitizer, you also want to get in between your fingers and you want to get the back of your hand. Then, in order for the killing action of the hand sanitizer to actually work, it needs to dry. Once it dries, the drying effect of the hand sanitizer is really where you're getting a lot of that action, which a lot of the virus and bacteria is happening. And alcohol, which is really the key ingredient that kills viruses, does evaporate or go away and dry pretty quickly. Then you go ahead and put on your gloves. So if you do decide to do this, there isn't a lot of recommendations on wearing gloves, but some people like to do this and then they like to go out. Then you wear the gloves. So if you go to the gas station, if you're going and touching elevators, or you're in cleaning, you're a person who's cleaning a hospital, or maybe you're a person cleaning an office building, or whatever it is, you want to wear gloves because you're touching a lot of public surfaces. The key thing here is if I'm using the gloves, the one thing I don't want to do is touch my face with these gloves. So I'm also wearing a mask at the same time. So let's say I'm wearing the gloves and the mask. Okay? Same thing. You don't want to keep touching the mask with your gloved hand because the gloves can carry the virus on them too. Now, the first person to actually wear gloves was a surgeon. His name was William Halsted from the United States, and he actually got gloves from the Goodyear Tire Company. He had them made. He initially had them made for his scrub nurse that he did surgeries with. And what was interesting was that once everybody in the operating room started to wear gloves, and these were not sterile gloves, these gloves are not sterile, his infection rates dropped. So definitely gloves have a role to play, but you have to know exactly how to use gloves. Now, so that's how you take gloves on and off. That's the tip on gloves. I myself am from the surgical world. When you step inside of an operating room, it is considered to be a sterile place. There's special ventilation inside of an operating room to keep the air clean. The entire place is scrubbed down. So we have special air conditioning. We have amazing staff, maintenance staff, janitorial staff, nursing staff, keeping everything clean. All instruments and tools are sterilized, which is a procedure, and that is a sterile room. The next type of room we have is what's known as a clean room, is a clean area. That means it's been cleaned. It may have some good ventilation in it, and that might be something we would see maybe in a clinic or a pharmacy. We consider this the clean room. Okay, and then after that we have what's known as contaminated. Generally what I would say is the actual going out everywhere is mostly contaminated. Going inside of elevators, touching door handles, going inside of bathrooms, these are all contaminated areas full of different viruses and bacteria. So we want to be careful whenever we touch a contaminated area that we either use hand sanitizer or we wash our hands for 20 seconds. If we do use gloves, even when you take the gloves off, make sure you sanitize your hands. Okay, that way you take the contamination off of you. The clothing we wear, if we're interacting a lot, for instance, if we're people who work in hospitals, healthcare workers, we generally will take these clothes off and we will wash them after we leave a healthcare facility. And that should kill most viruses and bacteria. Not wearing gloves, if you're going out there, you're touching a lot of surfaces, make sure you are not touching your face afterwards. So the number one thing is that not only can you get the virus from the actual air, but you can actually get it from touching surfaces and then touching your face. So one important thing is to not touch your face if your hands are dirty. That's a hard thing to remember to do. Everybody's kind of used to touching their face. It's difficult for most people, and the average person touches their face, I think it's like 20 times an hour or something like that. That's something that we have to get used to not doing. If we can do all of those things, we can decrease the rates of getting the virus and possibly having someone die from the virus, and then we can kind of move on from this whole situation. But once again, I would say that if you're practicing all of these things, fear levels will go down, and we want to be respectful of other people as well as we do all of these things. And so with that, I hope this video was helpful. Thank you very much.